Good morning, guys. Today I'm here with the topic diabetic ketoacidosis that is very, very common in critical care unit. It's one of my favorite topic that I like to discuss about because this is what something that frequently occurs in ICU, and I feel like we mostly as nurses should have wide enough knowledge about this so that we can treat this condition in the ICU with enough knowledge. So let's start with DKA. What is DKA? DKA is diabetic ketoacidosis that occurs when your body does not produce enough insulin. So in order to compensate for that, body starts breaking fat as a fuel, which causes the buildup of acid called ketones in the body. So if it's left untreated, it causes diabetic ketoacidosis. So that is what a diabetic ketoacidosis means. Where it is more common, it's more common in the patients with type 1 diabetes. Common can be with type 2, but mostly with people who are diagnosed with type 1 diabetes. How do we diagnose diabetic ketoacidosis? With someone whose pH is less than 7.3, we do the arterial blood gas, and the pH is less than 7.3. You will do a serum BMP, and then you will see an iron gap. It would be greater than 12. You will have serum ketones in the blood and the urine. You will test your blood and urine for ketones. Glucose greater than 250. You will also, where you will be doing the serum, where you will be doing the BMP, you will assess for the serum bicarb on the BMP lab results. If it's less than 15, patient is diagnosed with DKA. How do you find that the patient is, what are the symptoms that you notice? You will see of most of the things, polyuria, polydipsia, polyphagia. They will be excessively thirsty, they will have headache, they will be frequently urinating, they will have nausea, vomiting, they will have rapid breathing, which is also called Kussmaul breathing. That would be to rectify, the body will be compensating to rectify the acidosis caused by it. So what triggers it? The triggers for diabetic ketoacidosis is the illness. Illness is how illness causes it. The patient, sometimes they will be vomiting because of the illness. That could cause dehydration, and due to the dehydration, the TKA is very prevalent and common. Plus, people who are on the insulin, they will be missing their insulin doses. Sometimes their pumps are not functioning, they won't know about it, or they have been missing their doses, and that's how the DKA would be triggered. So as we discussed before, blood glucose greater than 250, pH less than 7.3, ketones found in the urine or blood, serum bicarb would be showing, it would be less than 18 on the BMP. That's how you would diagnose a patient with DKA. So what is the treatment? Treatment would be the patient would be started on the insulin drip. So for the insulin drip, the nurse would be assessing the blood glucose levels every hour. Very, very important when the patient is on the insulin drip. You have to monitor the blood glucose every hour and notify the provider. Sometimes the hospitals will have their own policy. They will have their table for titrating the insulin drip up and down, but a lot of times you will be notifying the provider and getting hourly order for the insulin drip. That is very, very important. You will be doing your electrolytes frequently, BMP to check the serum bicarb, and you will be assessing the potassium, most important, potassium. Potassium would be always low when the patient is in DKA, so you would be supplementing a lot of potassium while the patient is in DKA. And then they would be aggressively rehydrated, IV fluids. Most of the doctors, they would like to start them on Normazole. But say their blood glucose level is less than 250, right? if the glucose level is less than 250. So now, until the gap closes, you want the patient on the insulin drip